All's well with everyone. Welcome in. We're going to get started in just a second. Let me send out my shares so that way we can get this conversation started. Okay, so today we're going to be talking about the shift that we are currently in our healthcare system and really breaking down why we cannot wait and why we need to start making a plan B for ourselves in the system that we are under currently, because we're living in a time where healthcare has not only shifted in front of our eyes in the past few years, decades, whatever, but also we are in a path, we're in a time where we're all going down a path of having illnesses and diseases earlier and earlier, and we're not seeing the signs that we may not have coverage, we may not have the support that we used to, and not only will we're not only may not have that, but we also are already in a shift where things aren't, I'm trying to figure out the way that I should put it. Things aren't the way that they were set up and designed to originally. And so since, hold on one second. Hold on, y'all, one second. Okay, y'all. Sorry about that. Okay. We are in a space where we can observe and we can look and we can see the past history of what our healthcare was designed to do versus what it's currently doing right now. And the shift has been so major to the point where the crumbling effect, it's only the beginning. I'm going to say that the crumbling effect that is happening, that is taking a toll on us, is happening in front of our eyes, but with so many other stresses going on that people cannot put two and two together of what is happening. Doctors are being laid off, nurses are losing their jobs, hospitals are closing, insurance companies aren't covering the basics of things that people have been covered for years, and now they're quietly starting to drop people from insurance companies, or they're just refusing to cover even the basics in their benefit package. And so the question that I have for you is, if you know these things, if you hear these things, if you have not known these things, but if you are currently in the space where you know and you understand, imagine having a surgery or needing a surgery and you not being able to pay for it because your insurance refuses to cover it. You don't have the money to pay out of pocket. Imagine having to take a medication if you are on a medication, or if you haven't changed the way that you eat and you think that you're not going to develop a disease or an illness, or you know that your family has something that runs in your genes, right? That's where y'all have y'all's mindset at. And so you know that you're going down the path of having diabetes, high blood pressure, or whatever else. And then you get to the space where they no longer cover that medication and you have to pay thousands of dollars out of pocket every single year. Imagine getting hit with a $40,000 bill that you have to pay out of pocket, and on top of that, during a recession. Because that's the space that we are currently in. It's not where we're going, that's the space that we are currently in. Women getting denied for surgeries to remove their fibroids and their cysts. Hospitals closing and people not having the hospital care that they used to be able to have because lack of nurses, lack of doctors, lack of space. And we know what happened in 2020 when that happened. They stopped letting people go into the hospitals. They started rejecting people and telling people if it's something minor, that you should deal with it on a telehealth visit, on a phone call. Now, can you only imagine that if you were in the space where you can't afford to go to the doctor, they've raised the price for you to go visit a doctor to make sure you are okay. And they tell you to hop on the phone and tell them everything that's going on. And they're still charging you the same amount that they would if you walked into the doctor's office that day. That's the space that we are currently in. Not where we're going, but that's the space that we are already in. Because 2020 was literally the highlight to show you exactly where we're going, what is happening, how scarce the medical industry is going to be. And then now here we are in 2025, and we're seeing that all starting to come in flourishing in your face. There is no reason for somebody who had so much job security, like a nurse or a doctor did, to now be sitting here worrying if they're going to be let go, if their hospital is going to close. There is no reason for people who pay thousands of dollars a year to these folks that are supposed to help you be healthy, keep you alive, right? And you're worried about if they're going to cover you for something that you have when you need to file a claim because something has happened. But that's the space that we are in. It's not where we're going. And so when you hit that hard truth and you see what's really happening, not just asking the what ifs, but see what is actually already happening and putting two and two together, you'll realize that you're waiting on a system that no longer has any other options for you, but besides pay top dollar. You're waiting on a system that no longer gives you any options. Plan A was the healthcare system, Western medicine, and it has failed you. You have relied on this plan A for years and it has never supported you. It's never helped you heal. It's never shifted anybody in your family into healing. So why do you keep depending on a plan A that has already failed? Because in reality, when you look and you see the dire situation that we are under, it's time for you to have a plan B, a plan C. And that plan B and that plan C is starting with you first, taking care of your body. Then starting with your health when it comes to using food is your medicine. Not just getting in the gym and hoping this is going to fix everything, but understanding that in order for you to start taking care of your body, food has to incorporate itself in your life as medicine. It has to heal. It can't just be something to fill your body. And when you're using it as something just to fill your body, you're going to be going down the same path of overworking your body, not knowing how it actually works, not knowing how it should actually feel. Your liver, your pancreas, your kidney, and your gut, they are a key factor in your health, and a lot of people are not taking care of themselves, nor are they actually pinpointing why they're so tired, why they're inflamed, why they're hormonally imbalanced, why they're trying to use caffeine in order to get energy to use throughout the day. And this is all because you were depending on this plan A, which is a system that does not take care of you. Because they have programmed you into believing this is the way that you live. This is a part of life. This is just how it is. And since you were in the space of believing this is how it is, this is what it's going to be, you never actually sit back and realize your body is able to heal itself and then take the action steps towards healing. But instead you sit by every single day thinking this is a part of being a woman. This is what I have to deal with. And you never get the shift because you never change your mindset around what healing is actually supposed to look like. When you were in the space of believing diet culture, you will never be able to see how your body is actually supposed to shift and feel when you are aligned with it. Because diet culture is making you out of balance. Just as bad as the terrible foods that you eat on a regular basis, processed foods, all these chemicals inside of your food, additives and fillers. You sitting here consuming GMOs. You sitting here not knowing what's going on with the meat and how meat is tainted. Not reading the labels nor doing any research on any of the companies that you buy products from. Who owns them? Who's producing them? Because when you actually start to put the connections together, put two and two together, and understand that just because a label says something does not mean that they're not lying to you on it, and you need to do more research, flip it around, look at the ingredients, understand what is happening, you'll realize that they've probably been poisoning you for years because the ingredients have not been the same. When you look at the old history versus now, of like, it used to be where there was minimal ingredients, limited ingredients, food actually spoiled on a regular basis, versus now food can sit on shelves for weeks, no mold, and even when past the due date of when it should have mold, still no mold. The quality of bread is trash. The ingredients are a book, and you're not sitting back and asking yourself, how in the world is my body not stabilized with the foods that I'm supposed to be eating? Because when you get in the space of talking to not only others, but actually understanding how food should be making you feel, how your habits have A way to be easily shifted when you simplify the process, and how alignment starts with you syncing with your cycle as a woman, you'll understand that stability was never in the space of plan A, which is healthcare. But stability is in relying on your body's natural ability to heal itself from the inside out and not poisoning it every single day with the foods that you eat. Because when you want stability, healthcare cannot give you that. And we see the results of how it cannot give you that based on what is happening with the millions of women who are dealing with hormonal imbalances. What is happening with the millions of women that are suffering from high blood pressure, heart disease, dealing with diabetes. Because the majority of these major chronic illnesses and diseases that women are dealing with is a lack of syncing with their cycle. Because, for example, you dealing with the issue of insulin resistance every single month, a lot of y'all aren't realizing the reason why you develop diabetes by the time that you're 40 or 50 is not because it runs in your family, but because you do not understand that you every single month go through a insulin resistant state. And during that time, you should not be consuming sugars, but instead consuming more stabilizers, because this is going to help you be able to shift into the space of you menstruating. But instead of you putting two and two together and understanding what is happening and then making a shift towards changing your habits, not just doing diet culture, but actually getting rid of the foods that are making you toxic and poisoning you, you think, well, it's going to happen one day, so I might as well enjoy my life because I'm here for a good time and not a long time. But is it going to be a good time when you're dealing with IBS, when you're dealing with insulin resistance, when you've now developed some type of diabetes, high blood pressure, and they're diagnosing you and they have no coverage for you, so you're paying that bill out of pocket? Can you only imagine when your bill is thousands of dollars and you don't have that out of pocket? Can you imagine having to pay for a prescription that is over $100 a week? And having to pay that out of pocket? Because that's the space that we are in. We were already there in 2025. They were showing us what was happening. But the difference between the people who saw that and took that and realized and used that as self-actualization of I need to shift my habits and change, versus the people who saw it and panicked and then everything went back to normal and fine and everybody's okay. We're going through a recession. Everybody's having a hard time. And putting yourself in the same category of people who normalize struggle, who normalize you not knowing how to take care of your body. The people who have changed, who have shifted, who have seen, are not going to be dealing with the scarcity issue of the mindset of panic when it comes to the medical industry, because they've already stepped into the space of balance. But when you were in the space of thinking that everything is okay and that at the end of the day, they're going to get it all together and Western medicine supports you, you're going to be in for a rude awakening in these next couple of years. We're already seeing the shift and people are already experiencing the issues with layoffs, with the issue of hospitals closing, with Medicare and Medicaid and that issue that they have going on. But that's just scratching the surface. It looks scary now because older people are affected by Medicare and Medicaid, right? But it goes deeper than that, than just the older people being affected, because that's just literally the chip off of a bigger iceberg that they are slowly chopping into small pieces. Because it's not just affecting the old people, but it's understanding that they already know that people are getting sick younger and younger. And since they know that people are getting sick younger and younger, they're starting to take away these benefits and this care so that everybody is sick. Not just the old people without coverage, but everybody is going to be sick and without coverage and having to pay too much money that we don't have. And we're already in the space of a recession. So how bad do you think it's going to get by 2030? Because these are the plans that are already being implemented, and they've been implemented over this past year. And we always talk about how things don't start to shift until about 4 years after that person that is in office, right? But how come it's only taken less than a year? Less than a year for us to already see a shift in many different aspects, not just healthcare. So can you think about when these insurance companies who are already not covering y'all for basic things decide that they're no longer going to want to pay for insulin? That there are no laws under the space of them having to cover your medication or your surgery. So they're no longer going to help you remove your fibroids. They're no longer going to cover you for any type of cancer treatments. Or better yet, they have different stages. So if you're stage 1 or stage 2, you get a certain amount of coverage. When you still hit stage 3 or 4, they've already chopped you up as dead, so they don't care. Think about it, because that's the space that we're in. It's not a what if. It's a matter of when this happens to your family, when this happens to you, when they implement the laws, when they shift in the insurance company, when they drop you. Because it's not what if. I have friends in the medical industry. I mean, not only clients in the medical industry, but friends in the insurance space. They're not covering y'all. And they know this. They're having seminars that is talking about the shift between AI and the shift in the space of not only medical industry, not pharmaceutical, what is it called? Car insurance. All of the insurance companies are in on it together. They're setting up the plots of how they are going to benefit in this next shift, and it does not include you. It only includes the people who can pay top dollar and actually benefit the companies. Because think about it, and this is completely different from healthcare, but it does put a perspective, because not everybody goes back and forth to the doctor, but pretty much everybody has to use a car. Think about how insurance companies do not want you if you have more than 2 claims on your insurance. More than 2. Can you only imagine if you have some type of medical issue and you have more than 1 claim and they no longer want to cover you? Thank you for liking up the live. I really appreciate it. Like, really sit back and think about it. The same way that car insurance is so hard for you to get if you have more than 2 claims on your record, and how they don't want you, how they drop you, or how your premiums are so high, that's the way medical industry is going to be. That's the way that it has already shifted. That's the way that it's going to be in these next couple of years, and it's going to stay that way. It's not going to go back down and everything's going to go back fine. That's the space that we are in, where they're going to look at your medical industry, see that you've had to have a surgery, see that you're already on a prescription or 2, and they're going to say, you know what? You're not worth the risk. I'm not going to cover you in your 10 medications. If they do decide to cover you, it's going to be a high premium, high basics. And then if you need anything else outside of that, they may even drop you in the middle of your coverage. Or they're going to look at you and say, you're going to have to pay out of pocket because we have nothing to give you. These companies are out to look for themselves. They're not small businesses that need the customer. They know that you guys need them, and they don't care. But when you are in the space of understanding not only the current layoffs and the insurance cutbacks, but putting and reframing your mindset around, this has never supported me anyway, so why do I keep depending on this plan A system of Western medicine that is designed to keep me dependent to them, instead of making the plan B and the plan C that is not only possible, but it's also sustainable? Because it's sustainable when you actually start to put yourself in the space of healing and understanding that you're more risky depending on plan A than you shifting away from the medications that you were on. But you start doing that by using food as your medicine, eating your nutrients, eating a rainbow plate. Stop sitting here thinking that what you're currently doing is fine, and as long as you follow diet culture, you're going to be healthy and you're going to be fine. Because you see the results of that. It does not support you. You're depending on a system for your health and putting your system in somebody else's hands. And not only is that risky, but it's going to be your downfall because they don't care about you. The doctor sits there, gives you a diagnosis, gives you a prescription, or tells you need to have a surgery, and then they go on with their business. Like nothing ever bothers them about your health, nor does it make them make an action plan for you, nor do they help you be able to heal in any way, shape, or form. But what do they give you? Diagnosis, prescription, or surgery. This is the plan for everybody. How is everybody on the same plan, but yet nobody has seen a change? How is everybody on the same path of being healthy, regardless of what you're doing? You're following what they tell you to do. If you're in the gym, you're calorie counting and restricting. You're doing keto, paleo, Weight Watchers. You're doing all the different things they're telling you to do. You're trying these out, and yet you can't sustain a healthy lifestyle. Too many women, not only that I talk to and work with, but also are just here day by day, just making it by, think that there's something wrong with them, that they're lacking stability, they're lacking the willingness to actually change, they're lazy. And you have all this negative self talk that society has put on you under the space of them keeping you dependent on them. And you're not realizing that it's not the fact that you lack the motivation or that you're lazy or that you can't do it, but it's a matter of fact that they have programmed it to not be sustainable. And they know this. And so then this makes you believe that there's something wrong with you. And in reality, all their system is doing is breaking down your organs and making them work overtime. And this is causing your liver, your pancreas, your kidney, and your gut to not be able to be in a safe space, which puts your body in fight or flight mode. Because the liver is your detoxification space. This is the space where you are supposed to be able to filter your toxins, balance your hormones, and also support your digestive tract. But when your liver is overloaded with toxins, when it's overloaded with estrogen, when it's overloaded with foods in general, because your gut is off, your digestive tract is being overloaded, you are going to be sitting here congested. You're going to be sitting here fatigued. You're going to be sitting here dealing with weight gain, skin issues. It's like you sitting here imagining yourself in a hoarder house. You're sitting here trying to live in a hoarder house comfortably, knowing that it's full of trash and knowing that there's creatures in different things just festering all up under the trash. But as long as you just spray a little air freshener and Lysol and wipe down your windows and wipe down your mirrors, everything is clean, right? That's what you're doing with your body when you think that you're going to take a gut supplement, when you're going to sit here and all of a sudden now you're going to do this detox and cleanse for a week or two. Knowing the fact that you're still going to put more trash in your body, nor did you give it enough time to reset. Because if you've been eating trash for 10 years, 20 years, 30 years, a 2-week cleanse, a 2-week diet, and then a shift back to where you were at is not going to help you. And not only is it not going to help you, but all it's doing is just managing the issue that you have and keeping it alive inside of your body. So when you're eating these processed snacks, you have to think about it. When you're eating this sugar, this processed sugar, when you're overloading yourself with caffeine for energy, you're putting your body more into a fight or flight state. And this is going to cause you to be more hormonally imbalanced than your liver already is causing, because it cannot expel all that excess estrogen. Patients to heal themselves, but they stay dependent on meds. Yeah, the reason why is because they go through a program. I don't blame any doctor or any nurse for not knowing any better, because there's a reason why they put you through programming for however many years for you to be a doctor. There's a reason why you go through a programming of university for 4 years for your undergrad. There's a reason why they have this system in place, more than just, oh, you have to go to school and you have to get your education in order for you to get a good job. It's because they have to program you into the agenda and keep you in that space. And so how do you do that? Prolong exposure. How do you get somebody to not question anything that they have done? Raise generation after generation of prolonged exposure to whatever aspect it is. Pyramids, plates, school system, oppression, depression. Because if you look at society and you look at how we are, we as people, as earth, we go through cycles. And as society, population of human, we go through the same cycle every few years. And it has been that way from as long as we've been tracking it. And the only thing that has been prominently known is the fact that they keep it as an oppressed system of 1 minute we feel like we're finally getting able to breathe. Next minute they're putting us back into depression. Next minute we're going through a recession. After the recession, now we're coming back out of it and we're trying to breathe again. Recession, depression, recession, depression. It goes over and over again. Because even during that time of us trying to breathe, it's just us picking up the pieces of what they destroyed. And that's what you're doing with your body. But instead of it being, decades of, okay, 1 minute you're fine for 5 to 10 years, next minute we're going through a recession, this is what your body is going through every single year. You do diet culture around December, January. You're feeling good because you're starting to take care of yourself because you have a New Year resolution. By March, everybody has quit. Nobody's in the gym anymore. Everybody's talking about how they're lacking motivation and they'll try again before the summer. Summer hits, you're depressed, you're sad, you don't like the way that you're looking. Now you're trying to do another diet. Then boom, summer is over. You're feeling good for a little bit because maybe you did take care of your body for that period of time. Around the time of October hits, you're eating all the candy, you're eating all the snacks. It's getting cold again, so everybody wants those sweet treats and all those warm goods. And then by December, everybody's sick again. And then by the end of December, January, everybody wants to go on a diet again. I'm telling you, it's a full system to continuously make you feel uncomfortable. But when you step away from the system of what they have programmed us into and realize that you should not only be sitting here thinking that you have to go through waves of months not taking care of yourself, then going through a month of taking care of yourself every single year, you'll understand that they don't want you to learn how to sync with your cycle. So they completely throw you off away from it. So you don't even have any inclination of like how it's supposed to feel, how you're supposed to sync with your cycle, knowing what that feels like and what it looks like. But when you start to sync with your cycle, every single month you go through a cleanse and a reset. Every single month you have that aspect of you have that energy and you know how to use that energy. You don't have to depend on coffee. You're not going through fatigue in and out. You understand when it's time for you to rest versus when it's time for you to do the most strenuous activities that you possibly can. You understand when you're in insulin resistant state and the reason why you're craving all that sugar. You understand when you're going to need more greens, which support you in not being iron deficient. Because there are too many women that are sitting out here dealing with anemia. And it's a real simple fix outside of you taking an iron and magnesium supplement. Because that's what they're promoting to you. All these gurus that are giving you all these prescriptions, all these pills as some type of fix. They're not helping you be able to heal, but they're helping you manage the same way that the doctor is helping you to manage. And I'm never saying that you don't go to a medical professional, get some type of diagnosis, check out what's going on with you. But my problem is when y'all make that person that is in a lab coat, you're God. You hear a diagnosis and your life is over. This is what you have to deal with for the rest of your life. That woe is me and this is a part of being a woman. Instead of you asking the Most High himself, how come you made bones be able to break and be fixed and to heal themselves inside of your body? Nobody has to go in and fix it. It may need to be reset, but you don't have to fix a broken bone. But yet you're sitting here thinking that you have to deal with diabetes, high blood pressure, whatever else, hormonal imbalances for the rest of your life because a doctor looked you in your face and said, hey, you've been diagnosed with this based on your symptoms, or your test results came back, you have cancer. The only reason why you believe in this system so heavily is because of control. As people, we like things that are comfortable, we like things that are familiar. And that system is familiar and it makes you feel comfortable under their control. Because when you're in the space of taking your health into control in your own hands, you don't have that confined structure of nothing can work without us. Nothing can be done without them. But when you are out of that space, it becomes broader. You start to actually see how the body can heal from anything that you have going on. It's a matter of the actions that you have. Instead of taking the blame take the blame off of your family generations and what women have to go through and put that blame on the foods, the process that we're under. Shift your mindset, because too many of us are dealing with this overstressed state, which is causing energy crashes. It's causing our cravings. It's causing us to be in a diabetic state. It's causing our cortisol to be high. It's causing our adrenal glands to not be able to function the way they should be. And like I said, we are in the space where Plan A, which is the Western medicine system, is not supporting us. And it has not supported us. And they know it's not. And it has shifted into a toxic place that we all need to remove ourselves from. Remove yourself from depending on the system that has poisoned you. You pay insurance, go get your checkup. When they tell you that you have insulin resistance or you're showing symptoms of high blood pressure, instead of you saying, you know what, I'm going to take this prescription and I'm not going to have high blood pressure anymore, sit down and say, what have I been eating that has caused me high blood pressure? And if your doctor is a good one that tells you, if you're eating fried foods, you need to stop eating this, you need to stop eating this. Listen. Start eating more plant-based meals. Incorporate them into your life, because the space that we are going in, and how they keep saying, they were saying in 2020, I don't know if they're saying it anymore, how we're having all these food shortages, yet somehow food is still being supplied out like nothing is wrong, nothing has happened. Y'all are paying bukus of money for food that is poisoning you and making you toxic. These gurus on here that are in the gym, that look the greatest, that are promoting to you a gut supplement, or that are telling you that if you eat the leanest meat, that's the healthiest way for you to be healthy, and that you're okay eating dairy, those gurus are passing away. Like, I have seen at least 2 or 3 different news articles about somebody who was in their age of 30 on TikTok telling y'all to take this supplement, go on ahead and eat this. This is the way that I eat as a guru. And they're passing away. And let me tell you, it's not unrelated. Because when you're sitting here unaliving that early in life and there is no explained cause according to what they said their family has said, that it was just peaceful or they passed away, there was no known diseases, it's because the body inside internally is toxic. Y'all taking these supplements, you don't know what's in them, the casing or the product on the inside. You're consuming these powders, these proteins, all these different things that they're promoting to you on TikTok, and you don't know what's in them. But because that guru looks good and they lost 40 pounds, that's exactly what you do. But I'm sitting here as someone who is telling you, I don't take supplements, I don't calorie count, I don't restrict, I don't do any of that. I have lost over 40 pounds and I haven't taken any of that crap. And I lost over 40 pounds in a short amount of time. And I didn't have to calorie count, I didn't have to restrict, I wasn't in the gym heavy. All I did was simplify the process of eating plant-based foods and making sure that I was getting active and moving. Not going to the gym, not working out so I had the hardest sweat, but understanding that the body needs plant-based foods to flush itself. Food is medicine, and the food that they're giving y'all is not medicine. That if you're sitting here grabbing any and everything, whether it's fruit, vegetables, meat, whatever, you don't know the labels, you don't know where the company is getting it from, you need to start questioning. Because even fruits and vegetables, how people are like, are you not afraid that it's not genetically modified, even though it says on the label it's not? I'm not worried because I look up the company that I get it from. I know what appeal labels look like. I understand I know how to read my ingredients. I understand what an additive and a filler looks like. And I know how to pinpoint it just by looking what titanium dioxide is. I know how to look at citric acid and be like, you know what? That is not real citric acid because this company has a genetically modified or bioengineered label. And so that means that food is genetically modified. That means that fruit, that snack, whatever else has terrible toxic ingredients that is going to make you sick. And I talked about this last year, and I think maybe the year before that people are arguing that GMOs are not that bad, that they've been around for years. But since they've been around for years, and the U.S. is really the only one that does not do any research or any type of scientific studies, but other countries do, look at the other countries' studies on what genetically modified foods do to the body. It feeds a certain type of cancer that is different than any other cancer that we've had. It literally replicates and produces its own type of cancer. So why in the world are you arguing that a genetically modified food, bioengineered food, is not toxic to the body if every other country that has tested and tried them has banned majority, if not all, of genetically modified bioengineered food? Because it causes cancer. And guess who does not care about the consumer or the people enough to prevent cancer? The U.S. This is the space that we are in. And this is what I mean by the medical industry is not designed to take care of you, to help you, but to keep you a long-term customer. And so how they keep you a long-term customer is the medical industry and the food industry, the tobacco industry, all of these people, and I'm not going to go into heavy because I don't want them to take my life. All of them are together. All of them are in cahoots. And there is a systematic oppression that they're all aware of, and they keep you under. Because I've said this before and I'm going to keep saying it. If you're not the top 1% who is profiting in that space, you are in the little man who are not profiting, regardless of how much money you have in your bank account. Your brain is supposed to communicate with your gut to let it know what the adrenal glands are safe. Hey, produce enough healthy hormones. When it's not safe, overproduce estrogen. This is the response for your cortisol being high. And too many women are dealing with IBS issues and don't realize when you're having IBS issues, yes, you're going to have depression. You're going to have anxiety, because the reason why, your gut and your brain are directly connected. So when your gut is off, it's going to send a stress signal to the brain, and the brain is going to send stress signals to every other aspect of the body. And women store trauma in their hips. Stress is stored inside of our hips. What is a big major issue that millions of women are dealing with? Fibroids and cysts. And by the age of 50, they're seeing that women are more likely to develop fibroids. It's getting worse. So think about how millions of women, young women, are dealing with IBS and where that is leading us if we already have millions of women dealing with fibroids and cysts. They're diagnosing younger people earlier and earlier with diabetes, some type of hormonal imbalances, putting them on birth control. This is not isolated. Thank you for the likes. I really appreciate it. It's the matter of addressing the root cause, addressing what is going on. It's not just physical of, oh, I want to look good, but it's spiritual. It's emotional. It's a mental thing. And the energy that we have on the physical level or the spiritual level is not where it needs to be, because your body is speaking to you and you're not hearing it. The fatigue, the bloating, the brain fog, they're not random. They're messages from the body to let you know you're out of balance, you're out of line. And energetically, your hips, your liver, your kidneys, your pancreas, your gut, all of these are holding on to the trauma that you are putting it under. And when you're not nourishing, when you're not aligning to the body, you're not allowing it to reset, which is causing you to have the emotional chaos. The shift has to happen spiritually and physically. Because when you are in this space of depending on this healthcare system, you are going to continuously be under a stressful state, not knowing how to sync with your cycle, not having a body that can trust you. And they have taught us not how to, they have taught they have taught us how to not be aligned, but to be so out of sync that we don't even realize how much we are tailored, or not tailored, but connected to the earth, and how we should be tailoring our life around our cycle. But instead of us doing that, we depend on plan A, and plan A has made us sick. Plan B, where you should be right now, is building a sustainable resilience from the inside out, understanding how to sustain that from the inside out, keeping that so that you can raise a next generation of women and men who understand how important it is for you to get hydration on a cellular level, to get oxygen on a cellular level, use food as your medicine, and use stress regulation habits. Women who know how to cycle sync and understand the importance of depending on their cycle phases instead of depending on the system that is telling you how you should feel and what you should do every single day. Because if you could feel the steady energy that you should be every single day, I bet you could get more done. I bet you could feel more sane. That stress of, I have to get this done, I have this going on, and I need to go get something to eat really quickly, kind of releases itself when you actually have a sustainable thought of, I'm not starving because I'm malnourished, because a lot of people are malnourished day by day, regardless of how you're eating. If you're eating according to the system, you're not getting a plethora of rainbow foods, so you're malnourished. So then you're having to make quick, rash decisions based on a malnourished system. Versus when you are nourished, you can make a decision to go, I'm going to go in here and I'm going to have a snack while I'm cooking dinner that does not make me poison and toxin, does not raise my insulin during this time, and is not going to make me drain all my energy. Or have me in an insulin resistant state right before I go to sleep, which is going to make me have an issue with my energy for tomorrow. which is not going to have me up throughout the night thinking that there's something wrong with my sleep pattern. In reality, it's something wrong with the foods that you ate before you went to sleep. So, your health is not something that you need to play a gambling game with, but you need to make a plan B, because plan A has not worked and it won't work for you. Plan B starts today, not tomorrow, not when something shifts, not when you get diagnosed, because at that point you're depending on plan A and you've already been made toxic. But getting into plan B is understanding how to get that balance and getting that true transformation outside of the system that has poisoned you and made you toxic. And if you are ready to understand how to do that, and you are looking for a support system that is going to get you away from the space of plan A into plan B that is actually sustainable and is going to give you the success that you were looking for, my Balanced Body program is linked in my bio. This is going to help you be able to use food as your medicine and understand how plant-based recipes are the space for you to support your body in flushing and resetting. Getting away from diseases and illnesses and thinking that it runs in your family. Syncing with your cycle. Learning how to make your own non-toxic products and making your own natural medicine. Because we are in this space, as you can see with the medical industry, that you need these things. These are key essential skills that you have to have. No, knowing natural medicine, knowing how to make non-toxic products, that you're not using bleach in your home anymore. You're not spraying Lysol in your air anymore, because these are endocrine disruptors. These are going to make you toxic. This is going to cause cancer. Stop just eating and consuming any and everything, and understand how food is medicine, and start learning how to read your labels and putting two and two together with what is happening in our food system and getting away from it and releasing it. This is everything that I help you be able to do. And there's more in the Balanced Body program, because we have one-on-one sessions, we have master classes, and we also have the app that you are able to access and reach me during business hours anytime that you have any questions that you need full support. Because this is a process that I want you to be able to ask those questions, get into the deep, and actually see changes in your health. And I need to see that based day by day. The program is tailored to your lifestyle, what you have going on, how you operate. If you work a 9 to 5, if you're a stay-at-home mom, whatever it is, because everybody's life is different and everybody's shift is going to look differently, but everybody's answers is in using food. Food is your medicine, and if you're not using it that way and you're just consuming to fill, you're going to be toxic, you're going to be sick. So if you have any questions, drop them down below. What are your questions for me? And if you don't have any questions, I hope that I have answered them all throughout this live as thoroughly as I can. And I will see you guys in the next one. I know that I did not get on live when I said I was going to this week. I ended up doing my hair. It took a little bit longer than I needed it to. But we are here. We are done. It's okay. If you are not on my email list is linked in my bio, as well as that Balanced Body program. You can check those out. I send out a Wellness Wednesday email every single week. I also let you know when I go live, and I also let you know when our YouTube lives are posted. They're past lives, so if you've missed this one or any other one, you can go check that out on YouTube. The YouTube link, my Instagram, everything is linked in my bio. Go check that out. I'm not seeing any questions from you guys, so I really do appreciate you guys for the likes. I thank you guys for being here. I thank you for the questions throughout. Thank you for the comments. If you have any questions about the Balanced Body program, or if any links do not work, please feel free to DM me. If you're watching this later on YouTube, do not forget to subscribe. Drop any questions that you have down in the comments. I do respond to my comments. I hope you guys have an amazing rest of your Tuesday. I hope this live has supported you. And please don't wait for plan A to just take what it needs from you and leave you high and dry, but take what you need from the system and then use that to start establishing your plan B. Understand how we are already in a health shift and nothing is getting any better. So I'm going to get off, y'all. This will be posted on YouTube later on. I hope you guys have an amazing rest of your week. I post every Tuesday and Thursday on YouTube, by the way. So we do have a video coming out tonight, and we will have another one coming out on Thursday. Bye, y'all.